The childhood issue I'll be talking about today is malnutrition and the effects on development in early childhood. What is malnutrition? Malnutrition is a health condition that results from a lack of nutritional and caloric intake that meets the body's need. A consistent diet of foods containing an improper amount of carbohydrates, vitamins, proteins, and minerals can lead to malnutrition. One of the main causes of mortality among young children throughout the world can be accredited to malnutrition. In this picture here, you can see some of the physical issues that arise with malnutrition. On the left, this child you can see it has a bigger stomach or bulging, and that is due to edema. You can also see the moon face is also caused by edema and thinning of the hair. Also, in the right child, you can see he has loss of muscle mass, and he's very skinny, and you can see bones. Some contributors of malnutrition. It is labeled as the most severe consequence of food insecurity among children worldwide. So malnutrition is a result of availability, accessibility, and utilization of food and healthcare services around the world. There's different factors that contribute to malnutrition, which is specific factors versus sensitive factors. Some of the specific factors include food intake, access to healthcare, and caregiving. Oftentimes with malnutrition, the caregiving is poorer than usual. And then some sensitive factors could include cultural food practices, economic resources, healthcare facility, accessibility, access to infrastructure, and the sociocultural environment that they're in. Some terminology related to the issue. Wasting and stunting are common to see with the use of malnutrition. Wasting is a low weight for height ratio, and it measures the body's mass and height to accumulate the nutritional status of a child. Stunting is a low height for age ratio. The child is considered too short for their age. When you're underweight, a child's having a low weight for age, and overweight is a child having a high weight for height. And then severe acute malnutrition, or ASM, is a severe form of malnutrition measured by weight for height and weight for length. All these are pretty abnormal. You can see that to be classified for a lot of these, you have to be either -2 or +2, and for severe acute malnutrition, -3 standard deviations from the mean of the reference population. So it's pretty abnormal as far as other children. And then some normal childhood development should look like. Physically, is a normal development in a child who is properly nourished includes a steady growth for height and weight, as well as improvements or fine gross motor skills and dexterity. They're able to complete activities that use multiple muscle groups like running, jumping, or climbing. Also stuff with hands-on and dexterity like zipping up their zipper. On the right, this graph shows body mass index and what a normal and steady growth would look like. In the green filled in areas, a lot of those are overweight, and then the lines towards the bottom are considered normal too, and some of the lowest ones may be underweight. And then for normal social development for children, it's a critical period in early childhood where positive social behaviors have implications for improving positive health into adolescence and adulthood. Social and active play with peers should occur at this point, as well as a broadened use of language and verbalization towards their peers and adults or caregivers. Children are able to learn and pick up on social cues and initiate and hold conversations. These are all things that you would see in normal childhood development. And then for cognitive, what you would see is normal cognitive development in a young child involves learned coping skills, being able to problem solve, and increase intellectual capacity as they grow and acquire more knowledge. You'll see factors like processing skills, reasoning skills. The memory capacity becomes larger for the child, and they're able to develop their language further. Physical effects that you would see on a children who is malnourished, it's typically easier to recognize the physical aspects rather than the social or cognitive aspects. This is because the adverse effects improper nutrition has on children. What they would appear like is stunting, wasting, reduced muscle mass, edema in the stomach and face, prominent bones, and possible physical disabilities. And then internally, which you wouldn't really be able to tell, but they're at risk for these things, is greater risk of illness and disease, impaired immune system functions, and increased risk of mortality. And then smaller women usually have their pelvic muscles don't usually grow, which is required for reproduction, so that can cause problems later down the road when they may be trying to reproduce. And then the picture here on the right shows what a normal kid would look like, and then wasting and then stunting where they're too short. So then social effects on development is poor nutrition negatively impacts brain areas that play important roles of developing a positive social behavior. Studies in toddlers have linked child-reduced food intake to lack of active social play and verbalization. Anxiety and fear, which can be linked to malnourished children, often prevent children from socializing with peers. And then you may see social isolation or difficulty forming friendships or other relationships for these children who are malnourished. Some cognitive effects you might see on malnourished children is something long-term. Long-term nutritional deprivation often results in delayed mental development and reduced intellectual capacity, which can lead to intellectual disabilities. So you often see lower IQ scores, slower emotional development. Their coping skills with anger and frustration may be less than that of a normal child. You may see behavioral issues and difficulty problem solving. And then on the right, you can see a graph of what IQ scores of malnourished children versus the white is healthy children, it look like, and there is a pretty significant difference in percentages. Disparities you might see with malnourished children, a big one is intergenerational cycle of malnutrition. So this happens when women, usually when they're younger, they're malnourished, they grow up with all these like stunting and wasting and maybe physical disabilities. When they give birth, the baby is likely to have a low birth weight, and then the child is either has those physical disabilities stunted or also is malnourished, and that kind of is a cycle that we may see happen. And then other disparities include food accessibility, food taboos, and beliefs in cultures, cultural gender roles, and distribution of power. So typically, in many cultures, the males have more power in the family than females, and that can play a role in malnourishment. Cultural norms and dietary practices. Some cultures have dietary practices that may lead to malnourishment in children. And then socioeconomical status in certain cultures with emphasis on poverty and education levels. Prevention of malnourishment. So in many countries around the world, economics has a huge role to play in the prevention of malnourishment in communities, and often as people suffer from the lack of resources. So it's always hard to get resources, and it's hard to get people out of poverty. So impoverished communities may have little to no access to fresh, nutrient-dense food while being forced to consume mostly high-energy foods, primarily being carbohydrates. And then access to affordable nutrient-dense foods would definitely help prevent it. And then a well-balanced diet consisting of mostly fruits and vegetables and a sustainable agricultural practices for the community or family, either on a bigger scale or a larger scale. And then this my plate is, I have this here to, so you can see that most of the plate is fruits and vegetables, so it's important to get all the nutrients and then protein as well as your carbs, grains, and then some dairy. Intervention is important because with early intervention, children are able to recover from malnutrition, versus if they're left malnourished, they may not be able to recover. Children's bodies and mind can be resilient at this age, and they can likely bounce back with few problems if changed sooner than later. But getting them proper nutrients and minerals are critical for continued growth and development. So some interventions that can occur is dietary changes, community-based programs offering support, vitamin and mineral supplements if they're able, and then identifying underlying issues of malnutrition such as poverty and or lack of food accessibility, because that's usually the cause of malnutrition, especially in a lot of impoverished countries. And then postvention, in severe cases of malnutrition where stunting, wasting, or disabilities come into play, it may not be reversible even after rehabilitation of a child's diet because of the missed critical periods of development. In less severe cases, children are able to bounce back. It may be a slower process to catch up with other kids, but postvention can look like nutritional support, medical care, and rehabilitation, and in severe cases require rehydration and frequent small feeding so that they don't overdo it, and then addressing underlying issues also as intervention, like poverty and access to food, access to healthcare, etc., so that they don't go back into that malnourishment. And then here are my references.